When living with a certain condition, there are certain things that only you may notice that other people that may not even think about.
Hi, my name is Pauline and I live with psoriatic arthritis.
I was diagnosed in my 4th year of when I was studying my bachelor's in kinesiology. I have pain in majority of my joints. This includes my ankles, knees, hips, shoulders, elbows, and hands. The way I was diagnosed and the way the doctor mentioned it after, he did say that this is going to impact you mentally, but I wasn't provided resources to navigate it. A lot of times, doctors have a hard time grasping the impact it has mentally or how draining it is to experience pain every single day for the last 10 years.
So we know that mental disorders are much more common in people with arthritis. Between 20 to 40% of people with arthritis experience a mental health disorder at some point. But then where it differs is that people with arthritis have many other factors contributing to that can affect their mental health, like chronic pain, fatigue, having to manage a disease. All of those factors can negatively impact your mental health. So I think it's helpful to differentiate between what mental health is and what a mental illness or mental disorder is. You can think of mental health as somebody's overall state of mind or mental well-being, your capacity to cope with daily stressors. It exists more of on a continuum, and it can kind of fluctuate over your lifetime. So on the other hand, we have mental disorders, which are diagnosable conditions such as depression or anxiety disorders. And these cause persistent distress for a person and can impede their daily function for a long period of time.
I think it gets tiring always having to consider another factor while making every decision of your life, because sometimes I feel like I lose myself. The disease kind of overtakes my whole personality. I think, of course, when I first felt that way, I was very emotional and wasn't really rational about finding a solution for this. I was just really upset and just caving into those thoughts. But then I realized that the hole that I'm digging is it's not gonna help my situation. I wanna have the freedom or the autonomy to choose what I wanna do or what I don't wanna do. And I feel like if it gets worse and worse, I'm gonna have a harder time mentally dealing with the fact that, hey, there are things that you can't do.
In terms of optimizing your health overall and your well-being, we need to consider both the mental and the physical health. If you have arthritis and you have a mental health disorder like depression or anxiety, that can also affect how you respond to medications, and it also can affect your ability to reach remission in your arthritis. I think it's fair to say that perhaps in arthritis, because you're dealing with a chronic disease and you're trying to manage the medications that you need to take, the pain and everything else, there's quite a focus on the physical health, and the mental health might not be the priority. So another piece of research I did was looking at all of the people in British Columbia who had a type of inflammatory arthritis and then had depression or anxiety after they were diagnosed with arthritis. And essentially what I saw is that up to half of people with inflammatory arthritis who had newly onset depression or anxiety were not receiving adequate care for their mental health. And we considered adequate care, whether it was through antidepressants or through counseling within the publicly funded healthcare system. And then even when you're ready to get help, there are barriers in terms of financial ones, in terms of paying for counseling or therapy, because that's not funded by the Canadian healthcare system at this point in time.
So I started counseling about a month after my diagnosis because I noticed that the way I was feeling wasn't changing, that at first I thought maybe time would heal and in a few weeks I'd feel better, but that wasn't the case. And then the resource that I was provided from the university, I decided, you know what, it seems like the right choice. Talking to a counselor, I felt like I could fully talk about everything I was going through without judgment, even things that, I'd feel uncomfortable telling my parents because I don't want them to feel bad. The reason that I joined Arthritis Research Canada's Patient Advisory Board was because what I dealt with when I was diagnosed was a lot, and I just can't fathom other people also going through the same thing. Yeah, the work that Arthritis Research Canada does is important because they take in the input of patients into their research.
My main hope is that people feel that their experiences with respect to their mental health is validated. And I think it's just helpful to know how common it is for people with arthritis to experience these mental health challenges. And so I hope it just empowers people to seek help and to find the courage to move past that societal stigma, to have discussions about their mental health so that they can optimize their well-being.